Welcome back to Medical Monday. Thank you for joining us. I have Dr. Lucy Ledbetter from Advanced Neurology and Sleep in Columbia joining me tonight. Thank you for being here.
My pleasure.
We are talking about Alzheimer's awareness and prevention and taking your calls as always. 615-737+ is the number to call. And we're going to get right to it. We have Cindy on the line. Cindy, thank you for being with us tonight. What's your question?
Hello, and I am a patient of Dr. Lucy's. Although I don't have this problem right now, but I was just wondering if a baseline MRI would be helpful to diagnose, just in case in the future that I may come down with Alzheimer's. And I'll hang up and listen to your answer.
Thank you, Cindy, for calling in. Great question, because a lot of folks are thinking, especially if they've seen a family member with Alzheimer's, what should I do?
Cindy, I'm really glad to hear your voice. I know exactly who you are, and thank you so much for calling. Cindy, I hope it's okay to say I think you're concerned because you have a family history of some trouble with memory in your family, and in your particular case and knowing your history, I think that it probably would be a good thought to go ahead and get a baseline MRI. That does bring up a good point, that having a family history is one of the risk factors for memory loss and dementia later on, and so that's a very good point, and I do agree that that would be a good idea for you. So.
All right, thank you, Cindy, for calling. We also have Dorothy on the line. Dorothy, thank you for calling in.
Thank you.
Go ahead with your question. Make sure you turn down that TV so you can hear what's happening in your phone.
Okay. What it is I wanted to ask her, I heard there was a difference between Alzheimer's and dementia. Dementia, you have plaques, and in Alzheimer's, your brain decreases in size until it don't function anymore.
Well, let's talk to Dr. Ledbetter about that. And I think that is a common question a lot of people have. What is the difference between dementia and Alzheimer's? Because sometimes they're used interchangeably, and that's not the case.
Well, Dorothy, that's a really good question. Dementia means memory loss plus loss of some other abilities for any cause. It's a large category that encompasses a lot of different causes, and about 2/3 of the time that the cause for dementia is due to Alzheimer's disease. In other words, the most common cause of dementia is Alzheimer's disease, and Alzheimer's disease is a progressive form of dementia that can't be cured but can be treated, and you're correct, it does gradually cause shriveling and shrinkage of the brain, and over time a person loses their short-term memory and then gradually their speech and their long-term memory and really most of their neurologic abilities, and it's eventually fatal over about 3 to 10 years.
Okay, thank you, Dorothy, for calling in. Let's talk to Sue. Hi, Sue. What's your question tonight?
Hi. I've been treated over time for pituitary adenoma. I've had MRIs. And by the way, if the doctor could speak about anything that she knows about the latest findings about gladiolinium. And my question, though, about dementia is I'm supposed to have another one of these MRIs for the pituitary adenoma. I have a history. My mother passed away from dementia. And by the way, it's not on her death certificate, and I suspect that's the case of a lot of people, which means that the funding, if it were listed, I think would be a lot greater. But in any event, my question is, if I have the MRI, could I ask that I don't know how that works. In other words, the X-ray that they would be normally doing, if that would detect the area of the brain that would be where, if I have undiagnosed dementia, if they could see that and say, you know, in 10 years or something you're going to get it, or the likelihood is you're going to get it, or if they prefer to have, or if it's something where they would have to scan a different area, or exactly how would that work? I'm trying to see if I can't basically kill two birds with one stone.
Sure.
If that makes any sense.
Sue, that's a very good question, and you do have a complicated history. I'm going to answer the first question, and that is gadolinium. Gadolinium is the dye that's used when a radiologist performs an MRI scan, and it helps abnormalities show up better in the brain. you have a history of an adenoma, and sometimes adenomas are very tiny and sometimes they're very large. And if the radiologists are performing MRIs on you in order to watch the size of your adenoma, it's fairly important to use gadolinium so that the radiologist will be able to see it and be able to tell if there's change between MRIs. But to answer your question, I don't know if you asked this, but I'll just answer it. Gadolinium can over time cause, or it's associated with, I don't know if it's a cause, some shrinkage and atrophy in areas of the brain called the basal ganglia. And so we don't take gadolinium lightly when we give it to patients. If I can avoid it in certain situations, I try to. If I don't absolutely need gadolinium, I don't order it. But to answer your other question, what we would be looking for on MRI for Alzheimer's disease, since you have a family member that has dementia or has Alzheimer's dementia, that would increase your risk for dementia, and they would be looking at the areas of the brain called the hippocampus. You've got one on either side, and it's associated with memory. I think what you're wondering about is how can you predict your risk based on based on the fact that you have a family history. One thing you might do in addition to that is get tested genetically, because you can test for the gene for Alzheimer's disease, and even though you have the gene, it doesn't necessarily mean that you will get Alzheimer's disease. It means you're at higher risk. There are several genes that can increase the risk of Alzheimer's disease, and it's important to know, especially with a family history, whether or not you carry one of those genes. There are also a lot of different things that you can do to protect yourself and decrease your risk as well, and we may go into those in just a minute. But to answer your question, when the radiologist does your MRI, you can point out that you're at risk for Alzheimer's disease, and you want them to particularly look at the size and shape of your hippocampus and whether or not there's been any change. So.
Thank you, Sue. I think that's a great answer. Let's move on to Shayna. Shayna, thank you for calling in.
Yes, thank you for taking the call. My husband had an MRI a couple of weeks ago, and then they followed up with a blood test, but we haven't heard the results on that. I just wondered if you can give me an insight. About 3 or 4 years ago, I noticed that there was times when he just flat did not understand what it was, and then it would come clear that yes, this is what the situation is, and that's been going on, not getting any worse, but still continuing to a point. And also his brother and sister both had cancer, and they both had Alzheimer's, so it's a little confusing to me.
Well, your doctor is your husband's doctor is trying to find out what the cause of the memory problems are, and as we talked about a little bit ago, there could be some findings on the MRI that would indicate a treatable cause for his memory problems, and I hope that that's what they find. And also, when the doctor checks lab work, again, they're looking for things they could potentially treat and get better. With a family history of dementia, like you mentioned, in his 2 siblings, it does raise his risk for dementia and Alzheimer's disease, and it'll be important to sit down with the doctor and get those results and see, first of all, is there a treatable cause, and if not, is this indeed Alzheimer's disease? Because there are some medications that can improve your husband's memory if in fact that this is Alzheimer's disease, and also whether or not there's other family members, perhaps you have children that might be at risk as well, and what they might be able to do about it. So. Okay, thank you very much. Do you think the cancer had anything to do with it, the treatment for those other 2 family members? Well, it depends on what that treatment was. If, for instance, there was radiation therapy to the brain, definitely that can cause the brain not to function as well, and can cause, it could potentially cause dementia. It just depends on what the cancers were, whether or not it spread to the brain, and whether or not the treatment involved radiation to the brain. And also, there are some conditions where just a cancer in the body somewhere can lead to dementia, but that's very, very rare.
All right. Thank you so much.
Thank you, Shana. I do want to talk about some of the questions that have popped up and kind of been woven into a lot of these questions our callers have. The causes, let's start there, of Alzheimer's. You've talked about the hereditary factor. What else is there?
Well, we don't exactly know the cause of Alzheimer's disease, but we know that what we see over and over again in the brains of people with Alzheimer's disease are waste products that have built up in the brain. For instance, there's a substance called amyloid that's a byproduct of cell metabolism that for some reason in the brains of people with Alzheimer's disease have built up and surrounded the cells of the brain so that they don't function well. There's another substance called neurofibrillary tangles that are just, we don't exactly know how they get there, but they clog the function and the communication and the metabolism and the repair systems of the brain cells so that the brain just gradually doesn't function well and the cells eventually die. So we know that's what causes it, but we don't know what really causes those things to happen. We know that there are genes that people can carry that tend to lead to those things, but we don't know the specific reason why those genes will activate in some people and don't activate in other people.
And isn't there some research now starting to link cardiovascular disease and diabetes with Alzheimer's?
Absolutely, Carrie. Some of the most important risk factors for Alzheimer's disease are diabetes. Some people have even called Alzheimer's disease the diabetes of the brain because sugar is one of the things that tends to feed Alzheimer's disease. Sugar is elevated blood sugar, obesity, sleep disorders like sleep apnea that are also related to obesity, high blood pressure, high cholesterol, all of those put a person at high risk for Alzheimer's disease as well. And so there's a strong correlation between those things. And if, for instance, if a person carries the late onset gene, it's called the ApoE4 gene, then controlling blood pressure is one of the most important things they can do along with a healthy diet and healthy weight to prevent Alzheimer's disease.
So all the advice we've heard about taking care of our bodies also includes what's happening up here.
Oh, very, very much so. Very much so.
What's good for the heart is good for the brain.
What's good for the heart is good for the brain.
Okay, we're going to talk about more on that and more of your questions when we come back. If you have a question about Alzheimer's disease awareness, diagnosis, prevention, treatment, go ahead and give us a call, 615-737-PLUS. We're coming back after this.